Hello, I am Logan Weinman. This is my PSA for food allergies as an Eagle Project. We will be discussing what allergies are, how to deal with them, and why it matters to stay informed. Joining me for this PSA is my Boy Scout troop and Dr. Travis Sifers, who is an allergy and immunologist.
Hello, I'm Dr. Travis Sifers. I'm an allergist and immunologist here in Kansas City.
What are food allergies? Why should everyone be aware of food allergies, even if they don't have an allergy?
Food allergies are an immune reaction to a protein in certain foods, and that immune reaction results in an immediate release of inflammatory mediators that can cause things like hives, wheezing, decrease in blood pressure or lightheadedness, as well as sneezing, cough, and GI symptoms like vomiting.
What are the top allergens?
So it depends a little bit on the age, but in early life, the most common allergens are milk and egg, as well as peanut and certain tree nuts like cashew or pistachio, as well as some seeds like sesame seed.
Why do allergies exist?
It is a abnormal immune response that we think was probably originally used to fight off larger infections like parasites and helminths. And there are some theories that because of things like clean water and vaccinations, we don't get those types of infections anymore. And potentially this is kind of an immune dysregulation or an abnormal immune response, utilizing that arm of the immune system, but in an inappropriate way, attacking things that otherwise shouldn't be dangerous, like a food protein.
What are the levels of severity, and how do you know if someone is having a very severe reaction?
The thing that you want to know about a severe allergic reaction is anytime someone's having trouble with their airway. So this could start off with just repeated coughing, but oftentimes there's a change in voice or sensation that it's more difficult to breathe. This is the most common type of severe or very serious food allergy reaction. Some people may also have a decrease in their blood pressure, which would also be a severe food allergy reaction. And that's going to manifest with lightheadedness or someone fainting or passing out.
The different levels of severity are Class 1, which is mild, Class 2 and 3, which are moderate, 4 is severe, and 5 and 6 are life-threatening.
What is the difference between an intolerance and an allergy?
An intolerance is non-immune mediated. So if you think of kind of a broad umbrella of adverse food reactions, an intolerance could be something like stomach irritability after having really spicy food, or what's well known as like lactose intolerance, which is not an immune response, but instead the person who has lactose intolerance doesn't make the protein lactase that breaks down lactose into smaller sugars that we're able to digest and absorb. Since that's not absorbed, then it goes into the small and large bowel where bacteria will metabolize that and produce waste products, which include methane that can cause gas and diarrhea and cramping. A food allergy is a very specific immune response where early on the immune system has become sensitized by making antibodies that recognize the protein in the food. These type of antibodies are called IgE antibodies, and they will bind to effector cells like mast cells and basophils. So when the food protein is ingested, then the antibodies will bind that and activate those effector cells, releasing things like histamine that can cause hives, nausea, vomiting, wheezing, things like that.
Are there medications that can lessen or eliminate the effects of an allergy like you can with an intolerance?
Very recently, the FDA approved Xolair, which is the generic is omalizumab. It's a monoclonal antibody that binds up those IgE antibodies making it so that people would have a less severe reaction if they ingested that food. Other things for more mild reactions could be things like antihistamines like Benadryl or Zyrtec.
What are the different types of reactions?
So it's really a continuum of a single type of reaction, but you can kind of think of it based on the system of the body that is reacting. So in the stomach, these mast cells that are sensitized to a given food allergen, when they come in contact with that food allergen, release that histamine. And in the stomach, you can get things like nausea that would lead to vomiting. In the skin, same thing. Those mast cells see the protein, they release histamine, and then you get things like hives or welts or swelling. And in the lungs, same thing. Mast cells release histamine, but you can get things like bronchospasm or wheezing.
What should you do if you are with someone who has an allergic reaction to a known allergen?
The treatment's going to be the same whether it's known or unknown, if it is a true food allergy or allergic reaction to a food. Hopefully, someone that has a known food allergen will be able to communicate that they are reacting. And, for all of my patients and any patient that has food allergy, it's important to have what's called an emergency action plan. And that kind of dictates how to treat if you've ingested suspected or known food allergen. Again, the same things apply. If there's any issue with breathing, you want to go first to epinephrine. If it's just a few hives or just some stomach upset, then you can take an antihistamine first. If the reaction then resolves or doesn't progress, then you're fine. But if it does, again, not hesitating to give epinephrine is important. The main reason for that is that an allergic reaction is kind of like a fire. If that fire can spread, it's a lot harder to put it out. And so in an allergic reaction, the longer you wait before giving necessary therapy like epinephrine, the harder it is to stop that reaction.
What should you do if someone is seeming to have an allergic reaction?
People can develop spontaneous hives, welts, swelling, even swelling like angioedema of the lips and tongue that have nothing to do with a food reaction. So it's important actually, more often than not, it's not that they're kind of a new food allergy that they're reacting to. But if someone was having symptoms of difficulty breathing and lightheadedness and hives, you want to get them laying down supine so that their heart doesn't have to work as hard to get blood pressure or blood flow up to the brain. You can lift up their legs to kind of help with that as well. And then, of course, if you have antihistamines or an epinephrine auto-injector, then you could administer that.
What should you do while you wait for first responders?
So again, you want to make sure that the person or subject that's having the reaction is laying down with their legs up. If there's medicine nearby like antihistamine or epinephrine, you should always give that while waiting for first responders.
How do you know if something contains an allergen?
The FDA has mandated now that there are appropriate labeling for foods. So any food package should now list the top 8 food allergens, and you would just avoid that. There are less clear regulations regarding cross-contamination. So foods that are, made in a facility that may also, make something that contains peanut or some other food allergen can list that, but that's not required. Those types of reactions to that small amount of food are a lot more rare, even in people that are very sensitized. They maybe only like 2 to 3% of the time they're going to react to something like that.
How should you avoid cross-contamination while cooking?
The biggest thing when you're cooking yourself, it's pretty easy because usually those allergens aren't around. So I educate patients that are out at restaurants or things like that. And it's important to just discuss that if you have a true food allergy, that you give the person that's taking your order a little bit more information than just saying, I'm allergic to nuts or I'm allergic to peanut. A quick thing that I recommend patients to say is that, say, for instance, they have a cashew allergy. They just say, hi, I have a cashew allergy. That means trace amounts of that protein could cause an anaphylactic reaction. And that means that cross-contamination could also potentially cause that. So if you're cooking something that has cashew butter in the pan, you can't just wipe it off. Or if it's a salad that had cashews on it, you can't just pick them off. It needs to be food that's prepared without touching that allergen.
What is the best way to remove allergen contaminants from utensils?
Yes, if you just use basic dish soap and water, then that would remove it.
Is there a cure for food allergies?
The immune system is something that kind of hardens when it comes to allergy the longer that you have it. Really early on, if we can detect food allergies or potential development of food allergies in the first year or two of life, then it's a lot easier to give small amounts of that food protein in frequent, like daily dosing, and then build up a tolerance to those foods. And the most recent studies that are out there have kind of continued to show that early introduction of low dosing of food allergy can prevent developing that allergy, but also in people that are already allergic, get to the point where they no longer have that allergy.
Food allergies are not a joke. Food allergies are real and can be fatal. There are more than 32 million people with food allergies. With proper knowledge, avoiding food allergies can be done and make mealtime safe for everyone. Thank you.